Hello everyone, my name is Dr. Jen Littleton-Smith. I'm currently a lecturer at Cardiff Metropolitan University, was recently of Cardiff University, where I worked with my colleague Dr. Dan Burrows, who's a lecturer in social work, on this fantastic research project from Public Health Wales, who wanted us to look at the experiences and views of carers from the pandemic and from beforehand as well, to try and understand what kinds of policy and guidance should be put in place in the future. This has been a really wonderful project to work on for many reasons. Firstly, because we had a wonderful research team, because Public Health Wales were fantastic collaborators to work with, because we've got some really exciting impact plans from the project and further research projects stemming from it. The thing about the project, which was just amazing to be involved in, was the extended conversations we got to have with a real diverse group of nearly 50 unpaid carers. And we've all been through a hard year and a half. No one's, had a great time of it, whatever is going on in our lives. However, unpaid carers have really been an untold story during COVID. We've heard a great deal about, vulnerable people, about paid carers. There's the clap for carers, the focus on the NHS and the amazing work that they've done. It was quite incredible to hear what unpaid carers have been through, what they have managed to do and accomplish during this time, against a sheer lack of acknowledgement, I feel, from many sorts of media sources and in some cases policymakers, where they have been somewhat ignored sometimes in policy and practice guidance around the pandemic. Moreover, as I'll talk about later in this presentation, what unpaid carers have been going through for the past year and a half is not a temporary situation for many of them. Some of the restrictions and constraints on their lives, which for the rest of us have been brand new, have actually been things that unpaid carers have been dealing with for a very, very long time. And when the pandemic came along, this wasn't a whole new experience. Instead, it was a closing in of walls that were already existent for them. So it's been a really emotional project, and Dan and myself and our researchers, Lucy and Sean, we've all had our moments with this project where we've chatted to each other and about how emotional we've become in listening to these stories. So I'm really excited to tell you what carers had to say to us and our findings from this project today. Many of you, I know, will already be aware of what constitutes an unpaid carer. But if anyone's listening to this who isn't familiar with this group or isn't quite certain about how we classify people as unpaid carers, I'll just sort of go over this a little bit. So an unpaid carer is any person who provides care and support to somebody else. Usually this is a family member, but it could also be a friend or perhaps a neighbour, who would not be able to cope without their support. Now, the image we've got here on this slide, the chap with an older guy in a wheelchair, that's a kind of very stereotypical view of what an unpaid carer might be. Someone looking after someone who's physically incapacitated and who needs help to get around, or perhaps to organise their food or medication. This is not always the case with unpaid carers. People who care for others are often caring for people without a clear physical illness. There may be mental illness, addiction, learning difficulties or other developmental issues. There could be a whole host of reasons why someone requires care from a family member or a friend. And unpaid caring is not just about pushing somebody's wheelchair or cooking their dinner for them. It can, of course, be that, and it very often is. A lot of the time it's also companionship and friendship or other kind of relational support, where the person who requires care may be isolated or may have few social resources of their own to draw on. It is often has quite a strong element of emotional support regardless of the circumstances of their illness or disability. Very often an unpaid carer will be the primary emotional support for the person that they care for. Often that emotional support can be incredibly overbearing on their own kind of emotional well-being. It can be quite all-encompassing. And that's not just the case where mental illness or addiction is the primary issue. It can also be when there's physical illness or disability. A huge number of us in Wales are unpaid carers. 370,000 counted in the 2011 census. It is likely to be higher now, but we don't have the latest census data yet to inform us of that. So that's quite a staggering percentage of the population. I believe at the moment that would be about 10% of the population in Wales. It is absolutely inconceivable that the current social care and probably the health system as well in Wales could survive without unpaid carers. The economic value of the work that they do to replace professional social services and health services work exceeds the total budget of health and social care in Wales. So that's £8.1 billion annually. So the value that they are providing, not only to the person that they care for, but the country as a whole, is quite staggering. And one of the reasons that we were commissioned to do this research project was to highlight the value of this work and what unpaid carers are actually giving up, what they are contributing, and really to fully appreciate what they have taken on and understand how we can help and support them better. As we'll see, many unpaid carers do not feel adequately helped or supported in what they do, or even outside of what they do. And so we're hoping here that the findings we're going to share with you can have a meaningful impact on improving their experience. So how does engaging in unpaid caring actually affect the well-being of people who take this on? We already knew quite a lot about this thanks to the research of third sector organisations like Carers UK, Carers Wales and Carers Trust. So we knew partially what we were going to find in this research project. Carers UK have found that there are often limited opportunities for unpaid carers to engage in their own leisure and personal interests. The number of different things that they are juggling in their lives mean that their own personal time is incredibly restricted. They also have restricted access to pursue their own social relationships, not much opportunity to get down the pub, to hang out with friends, to go for a coffee. There's simply too much going on. Very often unpaid carers find full-time employment challenging. So will choose to take on part-time work or may have to not work at all in order to engage in the unpaid caring. However, you also see cases where unpaid carers have been able to maintain their employment, but as they're unable to commit to extra hours or higher level work that would impact their personal time, they do not progress in their careers in the same way that non-carers would. These limitations and restrictions have a notable impact on mental health. So unpaid carers consistently report increased levels of stress, anxiety and depression. And this was pre-pandemic. And they also have long-term impact on their physical health. Not only due to the fact that quite a lot of unpaid caring can be quite physical. They may be lifting or moving people who find it difficult to move themselves. However, they may also have quite disrupted sleep. They may struggle to kind of have a healthy diet themselves, or to quit smoking, or to do other things that might take care of their bodies. One particular issue is a limited time and opportunity to engage in exercise and other sort of well-being, health maintenance activities for themselves. These were things that we already knew about pre-pandemic. So we have indeed found these impacts within our study and more, which we'll go on to talk about in a few moments. So for our study, Public Health Wales asked us to focus on 3 key research questions. First of all, they were really interested in finding out current data on what unpaid carers in Wales' lives were like before the pandemic began. Then they wanted to know, how has the COVID-19 pandemic impacted on the experiences of unpaid carers, and also on the roles that they undertake as unpaid carers. So how has it affected what they actually do? Finally, they wanted to know about the impact of the pandemic on their well-being. How has this changed things, and what kind of support do they need to carry them forward positively into the future? What can we be doing in Wales to make sure that unpaid carers flourish after the pandemic is over? We, of course, talked about a number of periphery issues to this during our interviews. We designed interviews in consultation with carers themselves and with third sector organisations. So we were supported in this by Carers Wales and Carers Trust. And we produced interview schedules that covered a wide range of topics that arose from that consultation. I'll talk you through some of them in the next slide. So what did we actually do for our study? Well, Dan and I were quite clear that we wanted our primary method to be semi-structured interviews. Now, if you're uncertain about this, the difference here when we call them semi-structured, your traditional structured interview would be quite simply a list of questions that you'd ask ordinarily in order of every participant. And that has some strengths in that it allows consistency in the data and allows for the certainty that everyone's data is collected in the same way, which is quite good for the reliability of the data that you're collecting. Unfortunately, the downside of doing heavily structured interviews is that it puts the researcher in a position of power over the participants and allows them to kind of remain in control of the interview. Dan and I felt that doing that in this case would not be responsive or ethical in relation to what we knew would be quite emotional interviews with some quite, at times, upsetting narratives for participants to recount. We wanted to enable them to be in charge of the interviews and to direct things themselves rather than us imposing a structure on them. So a semi-structured interview, while we had a number of questions around different subjects to ask them, the interview remains flexible. So the interviewer is free to ask questions in any order that they feel appropriate, to omit questions if they feel it's not right to ask them at this time, or that they would be better placed later, or not at all if they aren't suitable. It allows the participant to find their own flow in the interview and to direct the interview according to their needs and preferences, which is very much what we wanted for this project. We had a really wide range of participants, so between 15 to 85. We got people from every region of Wales. We had a pretty even representation of the different regions of the country, all the way from Anglesey down to Cardiff. And people of many different backgrounds and caring circumstances. A group we did fail to recruit sufficiently from were people from minority ethnic backgrounds. I'm not going to go into the details of why that was here. We feel very much responsible for that, and we really should have had a longer lead-in time. We talk about this in detail in the report, which I'll share with you at the end. But apart from that, we did manage to get a really diverse group of carers, which was fantastic. We did, unfortunately, because lockdown restrictions were still in place when we conducted these interviews, which was in the early part of this year, we did unfortunately have to do them via primarily video call, and some participants opted for a telephone call, which was absolutely fine. As researchers, we don't really prefer that even after a year and a half of doing this, because you do lose some of that relational aspect of a personal conversation with someone, as we'll all know from doing our various jobs over the pandemic. Video calls are simply not the same, but at least, being able to see participants gave us a bit more insight into how they were kind of feeling, and kind of allows interviews to have a little bit more reflective space than a telephone call may do. Despite the fact that we were having to compromise by doing video calls, our interviews were incredibly rich and really emotional a lot of the time. Many participants, so at the end of interviews, we would stop the tape and have a little chat with participants about how they'd found the interview, if they wanted to talk about how they were feeling or anything else, if they wanted to reflect on anything they'd said off the record. And many of our participants took that opportunity to thank us for speaking to them about their experiences. Unfortunately, for many of them, it was the first time that anyone had sat down and asked them how they'd been and how they were coping and what they needed in a very, very long time, if ever before. So whilst that was at times distressing to hear, it was also really lovely to be able to offer that opportunity for people who, so many of whom very clearly needed someone to speak to. So we had these lovely 47 participants, few less interviews because a couple of them were group interviews with young adult carers who wished to be interviewed together. We undertook a thematic analysis, which means that you draw your findings out from the data itself rather than imposing a kind of framework over it, although we did use our interview schedule to try and code the data according to that, and then we kind of branched it out into other things that the participants had raised that were important to them. And the analysis was conducted primarily by myself and Dan Burrows, with some support from Lucy and Sean, our researchers on the project. After we'd conducted our analysis, we came up with four main findings categories for what we'd found in the data. The first of these was identities and relationships, which to us was incredibly important as a theme within the data. So here on the slide, you can see this is sort of divided into two main parts. So we've got, and this will be the same for every area of our findings. At the top, we've got the issues which were kind of experienced pre-pandemic, issues that have pervaded carers' lives regardless of COVID. And then at the bottom there, we've got specific points from the pandemic to consider for the future. So what we found in terms of identities and relationships, first of all, something really important we found is that there's still a real struggle for unpaid carers to recognise themselves as such. And quite often they would only realise that they were an unpaid carer when a crisis situation emerged and they were forced to kind of confront the fact that the caring that they were doing had moved beyond simple sort of familial responsibilities and bonds and turned into something more all-encompassing or overwhelming, and they realised that they needed help. and this was very often the prompt for them. What was striking to us is how few carers had been approached by a professional and notified that, asked that if they were a carer, in words that didn't use the language of caring itself. So quite often, unpaid carers, before they realised that they were unpaid carers, would see carers either just as professionals or as people who were, for example, caring for someone in a wheelchair, or someone who was spending their full-time hours caring. And they were then surprised to find out that wasn't the case, and realised that they themselves were unpaid carers. A funny thing I realised doing this project myself was that I was an unpaid carer for quite a long period of my life. I hadn't recognised that before doing this research, so I am a living example of how hard it can be for people to really recognise what they're doing in this area. We found a really strong theme of the relationship between the carer and the person that they cared for being incredibly important to how positive an unpaid carer's experience was of performing this role. It was important for them to have space from the person they cared for to kind of pursue their own personal life. But often it was highlighted to us by carers how important it was for them to share enjoyable times, fun times with the person they cared for, outside of having to do the caring itself. This would sort of promote the positivity of their relationship and actually make caring itself more sustainable and more enjoyable for both people, rather than the relationship being flattened into one of essentially a kind of working relationship of support and receipt of that support. We also found that many carers told us about how caring had really affected the whole family dynamic and the relationships between different members of their family. Sometimes positively, sometimes really positively, however, sometimes putting strain on different relationships as a result of them usually not having enough of their own time and space outside of caring work. These challenges faced by carers during the pandemic assumed slightly different characters and at times became, quite challenging to deal with. First of all, in terms of carer recognition, carers already very often feel ignored, and that word ignored was used a huge amount within our interviews, feeling invisible, feeling ignored by society. And the clap for carers and the recognition that we had for NHS workers and social care carers, professional carers during the early days of the pandemic was very frustrating for some unpaid carers who felt that they were overlooked when in fact they were conducting work that was just as important as paid professional carers. They also felt resentful that vaccines, when the schedules were announced, were prioritised first for professional carers but not for unpaid carers, feeling that they were in a similar category of need and vulnerability and yet were being ignored. The other thing that the pandemic did was it really increased the responsibility that many carers had for the people they cared for, which meant that they did have less time apart even than they did before. So, for example, when you have parents caring for children whose schools had closed, when you had professional carers who were supporting care within the home, who were no longer able to come because of social distancing, they would have to fill in the gaps. So there's increased responsibility and pressure, and this could have a real tangible impact on the quality of their relationships with their family and particularly with the person they cared for. And then in terms of more positive impacts, we did have quite a few carers mention to us how the pandemic had actually given them more time to spend those enjoyable times with the people they cared for. Sometimes to have more family time, to go on walks together, to spend more time together collectively, which didn't just revolve around caring tasks. So that was a really positive thing that came out of the pandemic. So This next section focuses on what messages for practice that we have from identities and relationships. If you look at our full report, and I'll share the link to that at the end, you'll see these detailed in much greater length than I can go into today, alongside our policy and guidance recommendations. But just briefly, what we really feel is important here is that we need to see health and social care taking a more proactive approach to identifying carers. Many carers had numerous points of contact with health and social care professionals where they could potentially have been identified as carers and were not. So we feel that we need to have renewed efforts on this front to ensure that carers are getting the support at the point where they need it and not at the point where problems turn into crises. One issue here was that of language. As I mentioned before, if many unpaid carers did not consider themselves carers because they thought of that as a particular kind of person who was caring for a particular kind of person. They didn't recognise the breadth of unpaid caring experiences that were included within this definition. So we may need to be more careful with how we use language around unpaid caring and think about describing it more in terms of its actual definition, rather than assuming that people will know what unpaid carer does and does not cover. We also felt that from the stories told to us about assessments for care and support on initial contact with social services, that there needed to be far more close attention paid to how the quality of the relationship between the carer and the person cared for, and what kind of support that both of them may need to ensure that relationship is maintained positively. One of the main factors for the sustainability of a caring relationship is that they still wish to carry on caring, that they care for the person so deeply that they are willing to keep contributing such a huge portion of their time and efforts to their well-being. And if relationships suffer or degrade, then you're going to find less willingness for them to carry on, given the impact on their life. As I mentioned before, the value that an unpaid carer gives to society from their caring is absolutely huge, and much of that value rests on this high quality relationship between the person caring and the person cared for. Moving on from that, there were also in many carers' narratives a need for some level of intervention, particularly post-pandemic, to ensure that the emotional well-being of both people was maintained and cared for after a level of deterioration during the pandemic and the strain that it had placed on these relationships. Some carers wished for some kind of counselling or therapy to help talk through some of the issues and the stresses that they've been through. Others simply wanted social support groups, both for themselves and the person they care for. Regardless of what form it takes, we need to be paying careful attention to the emotional and relational well-being of unpaid carers and the person they care for. So on to our second theme, which was the health and well-being of unpaid carers. So again, the prevailing findings that went above and beyond the pandemic. Through their interviews, we uncovered really high levels of fear and anxiety about how unpaid carers were going to carry on coping with how difficult and challenging their current situations were. Most of the carers we spoke to discussed some moderate, sometimes high level of stress and anxiety about how they were going to carry on coping. A big part of this was loneliness and isolation. While many carers were feeling isolated and lonely because of the level of responsibility they had prior to COVID, the lockdowns and the social distancing measures and the closure of kind of many activities or social spaces really reinforced this isolation to a critical degree that is completely unsustainable, would be for any of us, but for people who are caring as well, It was unbearable for many. We were very concerned about a number of our participants who reported really low levels of mental health and felt unable to pursue interventions to help them, whether due to time, money, or availability. So we really feel quite strongly that there is already existent prior to COVID a real mental health crisis situation happening with unpaid carers. If we go to the COVID-19 impact, of course, this was stress levels and anxiety levels were higher for all of us. But as I say, like for unpaid carers, this situation just got to a point where it was completely overwhelming for many that we spoke to. A particular impact here was seen in shielding. So for many unpaid carers, the person they cared for needed to shield because they were particularly vulnerable to COVID. And of course, what that means is then the whole household has to shield, including their unpaid carer if they live with them or if they're visiting them at all. So it wasn't simply a case of, the usual things being closed off to them, but also they had this additional layer of isolation from needing to shield to support the person they care for. Which was quite a heavy impact on those carers who did have to do that. So what can we do to support the health and well-being of unpaid carers? Well, one of the things that emerged really strongly in our findings was the value of social support groups, ideally within a carer centre that was locally available to them. Some carers were resistant to these, but by and large they were viewed as a really positive thing. And this was particularly the case for young adult carers between sort of 16 to 25, who massively benefited from the social support these groups offered. It's important to point out that one of the strongest elements of such groups was the fact that for young adult carers in particular, there was often a dedicated support worker supporting the group, and their relationship with this support worker in particular was a source of great strength and support for their well-being for young adult carers. One of the things we found was that many carers weren't sure if there was a carers group available to them or hadn't been able to find one, or that it was too far away to attend. So we do feel there's improvements to make in terms of promoting these services and perhaps in ensuring that all areas of Wales are covered by a social support group within reasonable access of every local area. Also, carers may need respite care for the person they care for in order to attend these groups, and the benefit of groups to people who want to go to them justifies, we feel, the additional support it may sometimes require for them to attend. A further thing which we feel needs to be improved within carer assessments is the way that professionals talk to carers about the burden that they take on through caring and how it may affect what we consider to be human rights. So a right to not work excessive hours or a right to physical and emotional safety, both of which are sometimes breached for unpaid carers, which may occur without them really being aware that they are being breached. It's important for us to recognise that these breaches may happen, and to check that the unpaid carer is willing to take these on and has the support to handle them in order to ensure the sustainability of their caring. Finally, we do also need support plans to be improved to ensure that there's enough provision there to support mental and emotional health of the unpaid carer. Something that was highlighted to us in a couple of interviews was the fact that the unpaid carer had been surprised when their carer assessment took place, and it almost exclusively focused on the person they cared for and their capacity to deliver care for that person, without a dedicated focus on how they themselves would find conducting this role and what strain it might place on them as an individual. So we feel there's space there for carers' assessments to be improved in their planning and delivery, to ensure that carers themselves are focused on during assessments and not just their capacity to deliver the work that an unpaid carer has to provide. So on to our third findings theme, which is employment, education and finances. And what really came across strongly in our interviews is how much carers who were also employed outside of the home really valued their work and the social opportunities that it gave them, the responsibilities and agency that they were able to pursue. And this was also the same in education, where younger unpaid carers or older unpaid carers who were in education really valued the time they were able to take here to develop their own opportunities and skills outside of caring. However, what we also found through talking to carers about this was the fact that they often felt like they'd had to compromise or limit their opportunities in order to sustain their caring role. Sometimes this was something that they felt a bit resentful about. Other times it was something that caused them stress and strain, feeling that tension between their own personal drive to succeed outside of caring, but then also that really strong responsibility in their caring role. And those two things being at odds with each other was a cause of great uncertainty for many carers. Another benefit of being in employment for carers is that it had a positive impact on their finances. Many of the carers we spoke to had financial difficulties due to the limitations on their capacity to work, or perhaps their ability to kind of pursue other opportunities that, so for example, were beyond commutable distance, so they'd had to move house, which would take them away from the person they were caring for. So caring had a really strong impact on work and then also on finances. And for those carers who could not work in particular, the amount of carers allowance that they're allocated within the benefit system was perceived to be incredibly low for the level of skill and effort that they put into their caring. And particularly for those carers who were essentially on call 24/7 for people who needed care throughout the night as well as throughout the day. The fact that they were offered this flat rate for the same level as someone who was caring for, say, a few hours a day. Some carers expressed that this was actually quite insulting, and they felt extremely resentful that this was the value being given on them essentially giving up their own personal life to perform this role. A further issue that emerged around this theme was how important schooling is for those parents of children who they care for. And as we move on to talking about the impact of COVID, the matter of school closures had an overwhelming impact for many parents of disabled children, particularly for those parents whose children were autistic or who had other behavioural issues and who relied on the break that schooling gave them in the day to kind of recharge and reset themselves ready to handle these issues well. Many carers talk to us about the challenges of coping and remaining what they perceived as calm and caring when they were not used to caring for their children 24 hours a day, 7 days a week in this way. In relation to work, one of the positives that COVID seems to have brought for many carers is the flexibility of working from home, which was particularly valued for those who were juggling their caring responsibilities. It meant that dealing with appointments and caring and perhaps, being able to work slightly different hours, all these things made their lives considerably easier. However, it does also mean that they are not getting a break. They're not getting personal time away from their caring role, which could also bring difficulties as well, people who are working were expected, where previously they would have been in the office and it would have been understood that they were out of the home for however many hours and unable to help, suddenly found themselves being called on a lot more in the day because, after all, they were at home anyway. So this was a challenge that flexibility could bring as well. Also, the impact of COVID meant that some people's finances, which were already in a somewhat precarious state, had a negative impact from reduced hours or from job losses within the family. So that could exacerbate what were already challenging financial circumstances. So what can professionals do to help in terms of employment, education and finance? Well, first off, we felt from our findings that there needs to be a bit more awareness about financial problems that caring can bring, and recognition that carers' allowance is very often not going to be enough to help carers deal with any financial struggles that they're having. And we need to make sure that the information about help and support that they can get financially is being promoted actively. We did have reports from several carers that employers were not very aware of ways in which they could support them as carers, and they felt like they had far less rights than, for example, parents who would have additional days off if their child needed care, whereas carers sometimes did not have that. Some carers may need support in negotiating with their employer, moving on from the pandemic, to make sure that any beneficial working arrangements like flexibility over time and hours can be carried forward from the pandemic. And we've also recommended in the report that we have a wholesale kind of review of guidance for employers on how they can support carers who are in their employment. Finally, in terms of students, we did find there was far more that educational institutions like universities can do to identify and support students who are unpaid carers. What we found speaking to young adult carers who were in education is that identification and support varies a great deal across different institutions in Wales. There's not a consistency of practice here. Some students felt very, very well supported. Others felt completely invisible, or that they were promised a lot of support that was not actually delivered by individuals who could have provided it. So we need to take a close look at what colleges and universities are doing to support unpaid carers and think about ways in which they can be encouraged and directed to improve. Our final theme looked at the services and systems that we have in place to support unpaid carers and their experience of these and their views on what they felt could be improved. We've already mentioned this, but just to highlight again, statutory assessments came under fire from quite a lot of carers. We didn't really have any positive experiences of a carer's assessment. At best, they were inadequate. At worst, they were upsetting. So the assessment system is clearly not working to give carers a positive experience of being cared for by social services. Another thing that came out consistently within our interviews is that carers spent a huge amount of time chasing services, that is, on the phone, via email, trying to find support that they needed, but consistently being passed on to somebody else or being told that that wasn't the right thing or that it couldn't be provided. And this time that they had to spend, sometimes daily, trying to find support for them and for the person they care for, was completely exhausting, and for some was the sort of last straw in terms of how they felt about being undervalued and under-recognised for their role in providing social care. More positively, we did find third sector organisations frequently receive praise from unpaid carers. For many, when we asked them about services that helped them most, it was third sector and the kind of tailored, individualised support they could offer people, particularly that relational support, being available on the phone or via text to offer sort of on-the-day ad hoc support to them during crisis situations. In particular, younger adult carers found the support workers through social support groups to be incredibly valuable to their well-being. And that there was several stories of really, people reporting that they couldn't imagine life without their support worker by their side, which was really lovely to hear. Overall, we did find that services that were more flexible and more individualised had greater satisfaction reported by the unpaid carer. So that's something which we need. I know it's already sort of promoted that flexibility and personalisation are very important, and we found that indeed that is something to keep pursuing within services. In terms of the pandemic, chasing services have become even worse for many people due to sort of staff shortages and restrictions on some services. So carers who were already kind of exhausted from trying to find the support they needed found this became even worse during the pandemic. This led to them feeling a real sense of abandonment, that they'd just been left to it, and the phrase that came up quite a few times was forgotten about. And obviously this level of disengagement is not positive for carers' well-being or mental health. However, where remote delivery was offered of support services, this was really welcomed. Everyone obviously was understanding that the pandemic is going to affect the way that services are delivered. So there was a lot of flexibility, even though carers would obviously prefer their in-person services to be delivered. So for the future, that promotion of remote support as early as possible is going to be a really positive thing. So in terms of how we can translate these experiences into improvements for practice, something that hindered a positive relationship between unpaid carers and the services that they accessed was they often didn't feel that the way that they were feeling, the level of stress and pressure that they were under, was taken seriously enough. So there's a need for us to ensure that consistent practice that involves simply listening to unpaid carers and the difficulties and challenges that they face is given appropriate attention during any contact time, because often they did feel dismissed or kind of brushed off. Furthermore, there was a feeling that there was not enough information about different services that were available. Often they didn't know what the eligibility criteria was for different prevention or intervention services. So they would try and obtain some support or some service, feeling that they would be entitled to it, would spend a great deal of time on it, and then find out that they weren't in fact eligible. So we need to be clearer about the eligibility criteria, and also about giving information about what is out there for carers, which is often quite hard for them to hunt down, whether online or in person. In terms of acting after the pandemic, as we discussed throughout the different findings, many carers' situations have worsened to the point where they are in the middle of or have recently experienced crisis, and their caring has stopped being sustainable. Some carers who we spoke to discussed how the only reason that they were carrying on was because they couldn't think of any other options, which obviously is far from an ideal situation to be in. We felt that the best thing post-pandemic was to enhance the provision of respite and domiciliary support, and also mental health and emotional health interventions for carers and the people they care for, to ensure that we can resolve these crisis situations and move forward in a more positive way. We also felt that there were messages here for policy. We need to have a greater awareness of what kinds of services are currently being delivered across Wales, what that map of support looks like, and where the gaps are in provision. Something that could support this is a national register for carers, but also we felt that the strongest provision that could be made here is regional carer support teams, perhaps sitting under health boards, perhaps within social services, who can coordinate care and support for carers and make sure that they are accessing all the services and provision that's available to them. We feel that whatever improvements are made, carers needs to be consulted with extensively about how we move forward here and how services are planned. because their sense of invisibility and their sense of having a lack of voice is really damaging to their self-esteem and to their capacity to carry on in the situations that they are in. So across our 4 findings themes, how can we summarise the impact of caring on unpaid carers at the moment, and what's the current state of their well-being? Well, prior to the pandemic, many unpaid carers were already living with unsustainably high levels of stress and pressure, and in many cases were completely unsupported with this by any kind of professional service, such as counselling or therapeutic intervention. Their sense of social isolation, loneliness, feeling invisible or abandoned, these already existed, and the pandemic has greatly increased these feelings among many carers. In terms of relationships between the carers and the people they care for, this has also been damaged by the pandemic, but it's very clear in our discussions with carers just how important this relationship is for making caring sustainable. So this is something that really needs to be focused on post-pandemic. The most important thing that carers told us about having positive well-being was feeling acknowledged and supported by services, for being recognised for the important work that they're doing and the contribution that they're making. We really hope that our report is going to help to highlight the experiences of unpaid carers and really provide some signposting as to how we can improve their lives moving forward in Wales. If you'd like to read the full report, and I'm really proud of this report, both myself and Dan are, it's got lots of lovely data extracts from our interviews which really enrich the findings that I've shared with you today, and includes a whole host of other discussions which we haven't had time to cover. You can find the report in English and Welsh on the Public Health Wales website. There's the link there if you would like it. And thank you so much for listening today, and I hope you've enjoyed it, and I hope you get a chance to read the full report. And do get in touch with us if you've got any questions or comments to make. We'd love to hear from you. Thank you.